Shalom, giving all praise and glory unto Yahweh Bashim Yahushai Bashim Kakadash, and double honors to the Allah Apostle, Allah Bishops and Brothers on Dawn Great Millstone. Salutations to the whole field. Like this is your brother Rai Banyamian, here to share a lesson. And the title of this lesson is going to be Their Belly Prepareth Deceit. Their belly prepareth deceit. As per Job, the 15th chapter and the 35th verse, which I'm going to grab later on down the line. But as you all see, as per CNN by Deidre McPhillips, published 2 days ago, it says, it seems like everyone has the C19. Here's why this wave is probably worse than official data suggests. And as you all know, the mask wearing is coming back. You see more people, driving in their cars with their windows up, wearing it. Certain places you may go, the doctor, dentist offices, grocery stores, post offices, or what have you. You're seeing more of the staff or patrons wearing wearing these masks and stuff. So it's pretty much like 2020 coming back in effect all over again. And if you all pay attention to the news rhetoric by guys like Bill Gates and Fauci, they have said that the new wave of infections is gonna get people attention where they didn't really pay much attention to the previous one. So I'm gonna read this article of a few scriptures and close it out. Lord willing, and be edified unto the elect. Alright, so the first portion of scripture I want to share before I push forward in the article is in the book of Habakkuk, the 2nd chapter and the 4th verse. It says, behold, his soul, which is lifted up, is not upright in him. So he's a proud man, you know what I'm saying? It says, but the just shall live by faith. You know what I'm saying? So he saw it up, he trusts in his ways, he trusts in his deceit. But the elect, not everybody, but the elect is going to live by faith, and they're going to trust in Yahweh Bashim Yahushai 100%. And that's what we want to do in these times where their belly, the inward part, right, their mind, prepareth deceit. So let's go into the article. It says, the C19 certainly didn't take a vacation this summer. Virus levels in the U.S. have been on the rise for weeks, but it's hard to know exactly how widely it is spreading. Now, they exaggerate these things to gauge people's reaction to it. They may throw out certain numbers, to bring about certain reaction, or maybe fear and anxiety, out of people, but the numbers may not be as high as they are claiming. It says, the federal data suggests that the current increases have stayed far below earlier peaks and notable surges, but judging by word of mouth among family, friends, and co-workers, it can seem like everyone knows someone who is sick with the C19 right now. And so that may not always be the C19, might just be the flu. Because I remember I've heard some co-workers said that they and their families were sick, and I remember I myself were down for about 3-4 days, so flu is going around, but it may not always be the C19. It says, we have several folks down with COVID. Unfortunately, it's like the C19. It says, One Health focused on profit told CNN when seeking comment for the story. Rates of several disease may be staying at relatively low levels, but experts agree that there are probably more infections than the current surveillance systems can capture. You understand what other surveillance systems that they are using other than word of mouth by friends, family, and co-workers, There's more transmission out there than what the surveillance data indicates, said Janet Hamilton, Executive Director of the Council of State and Territorial Epidemiologists. And we should be paying attention to it because we are starting to see an increase from 2020 to 2022. The University of Washington's Institute for Health Metrics and Evaluation produced regular estimates of C19 case rates and projections of trends. But the Research Institute paused that modeling in December. All of the measures that factored into the model had stopped being reported or had changed in some way, said Ali Mogdad, professor of health metric sciences and chief strategy officer of population health at the University of Washington. The surveillance system was not adequate anymore to capture changes in C19, he said. We felt that the margin of error became really too big for us to make a prediction that we could stand by and defend. Mogdad declined to quantify an estimate for current case counts, but he said he's been getting lots of calls and questions about C19 recently, similar to what he experienced around the end of last year. In mid-December, the U.S. Centers for Disease Control and Prevention was reporting about 500,000 cases per week. And IHME estimates from that time suggest that the U.S. was in one of the worst waves of the epidemic, second only to the Omicron surge. Tracking C19 trend has always had its challenges, but the rise of rapid home tests and general waning of public interest in testing at all has all but erased the ability to grasp current case counts nationwide. The CDC officially stopped reporting aggregate C19 case count months ago, noting that data had become less representative of actual infections or transmission levels over time. As case counts started to become less reliable, some experts first pointed to hospitalization metrics as a reasonable substitute to gauge transmission. Hospitalizations were regularly testing all patients, whether they were coming in for C19 related symptoms or for something else entirely, and they are required to report positive cases. The idea was that case rates in a hospital could serve as a proxy for case rates in the broader community. It says there were about 15,000 new hospital admissions for C19 in the week ending October 19th, according to CDC data. Less than half of what the numbers were at this time last year and lower than they were for about 80% of the epidemic. But hospitals have shifted their testing practices, balancing changing federal requirements and recommendations with local risk assessments, which makes it difficult to compare data from different points in time. It says when testing supplies first were readily available, we moved to testing everyone, including healthcare workers, routinely, including everybody who was coming in the door for any reason, said Nancy Foster, a vice president of quality and patient safety for American Hospital Association. Anybody and everybody got tested. It says although hospitals are still required to report any positive cases, they've eased back on testing to be more in line with guidance around other infectious diseases. The focus is on those who are symptomatic, have been exposed or might be around other high-risk patients. It says hospital admissions is much more of an indication of severity at this point in time than I think it is of generalized transmission, Hamilton said. It says many measures of C-19 and other public health surveillance rely on people to seek out clinical testing or medical treatment, and those behaviors have changed over the past few years. Wastewater surveillance offers a more consistent approach by monitoring the amount of virus shed in sewage systems. Wow. By he's performing a diligent search, man. God damn. But interpreting that data can be complicated, and with C-19, wastewater levels can be directly translated to case counts. The amount of virus that an infected person shares depends on many factors, including the presence of antibodies from a vaccine or previous infection and the severity of the current infection. Data from BioBot Analytics, a biotechnology firm that has partnered with the CDC, shows that wastewater concentrations of the C virus are similar to what they were at the start of the first winter surge in 2020. But now the vast majority of people in the US have some immunity to C-19 through vaccination, infection, or both. They say nothing about natural immunity. Those same viral concentrations can translate a larger number of infected individuals with milder but still contagious infection. Notice they ain't say nothing about natural immunity, right? Or, trusting in the Lord, for your healing, taking herbs. Says the upward trend is clear. Even if the exact number of new infection isn't clear, expert says the rising trends in the data that are available are enough to raise alarm. It says surveillance data is across a continuum. It says we want to have multiple different types of data that tell us different kinds of things. When they're all pointing in the same direction, that's maybe a time to get even more concerned, Hamilton said. Now going back, I'm gonna come back down, but going back to what they said, that they use data from a company called BioBot Analytics. It just shows you that we are living in a mechanical, technological society. Look what they're using. They're using these little bots, probably nanotechnology too, to test the wastewater. So when he saw New World Order, when the Most High allow him to get to a certain point where he's able to get the MOT under the skin of people, who knows what else is gonna rear its head, man. We are in for interesting times, Lord, when we live to see it. It says, continuing on, it says, and right now many key measures are indicating an increase. Weekly hospital admissions have nearly doubled over the past month, including a 90% bump in the most recent week, CDC data shows, and a sample of laboratory participating in a federal surveillance program show that test positivity rates have tripled in the past 2 months. There are some hopeful signs. BioBot data shows that wastewater levels may be starting to flatten, and relatively low hospitalization rates suggest there may be a lower risk of severe disease for many. But despite the clear signs of a summer surge, the US has been living in a fantasy world where people pretend the C-19 is not relevant. Dr. Deborah Birx, the White House C virus response task force coordinator during the Trump administration, told ABC Start Here podcast, "We wanted to make it like flu because that was easier, but it's never going to be like flu," Brooks said, explaining that C-19 comes in more frequent waves, makes people sicker, kills more people, and can have a longer term complication such as long C-19. So let's just all agree it's not flu. It will never be flu. Following it and surveying for it like we do for flu will never be adequate in this country. It says precautions like masking and staying up to date on vaccinations are especially important as this rise in C-19 carries into the broader respiratory virus season, expert says. It says with every respiratory disease season, whether it's C-19, whether it's influenza, whether it's RSV, it says those increases can impact different individuals in different ways. And there are always severe outcomes associated with respiratory disease season, Hamilton said. Now is the time for us to be practicing good respiratory etiquette. Now is the time for us to remind ourselves to think about our own individual health status and those individuals that we may be around. And that concludes the article. So they want people, to be consciously in mind of COVID, and they would be happy to see people actively, wearing the mask, whether they know the truth, or not. But going back to the title of my article, which is it says, "Dear Belly, Prepare Deceit." I'm gonna visit that book now in Book of Job, chapter 15 and verse 35. And these are the things that Esau Edom does. You understand? He puts certain information out there to see how people are going to react to it, whether they're going to raise fear, whether they're going to raise anxiety, while he watch back and take note. You know what I'm saying? But like I read in the book of Habakkuk, chapter 2 and verse 4, the just shall live by faith, right? So this is Job chapter 15 and verse 35. It says, "They conceive mischief and bring forth vanity, and their belly prepareth deceit." And when you go into that word belly, right, it says belly, womb, body, abdomen, right, as a seat of hunger, as a seat of mental faculties, the depth of Sheol. But in the short definition, it says meaning to be hollow. The belly, especially the womb, also the bosom or the body of anything, right? But then when you go further down, it says within, right? So inside of them, they practice deceit. Now, if you also remember Psalms, the 58th chapter, it also says that they be born speaking lies. So it is within them. And I'm going to grab that really quick as a follow-up scripture, and I'm going to close it out there. Because we need to know, who it is that we are dealing with to not fall prey, to his lies. So this is the last portion of scripture in the book of Psalms chapter 58. Remember, it says their belly cause a deceit, right? In the book of Job 15 and 35, within, right? But here where it says here in Psalms 58 and 3, it says, "The wicked are estranged from the womb, as they go astray as soon as they be born. speaking lies. You know what I'm saying? So it is within them, it is in their character from birth to be deceitful and to lie. And this is another lie that they are telling right now, that it seems like everyone has the C19, right? So they want people to panic, and they want to bring back in their draconian measures to further lock people down. But like it said in Habakkuk chapter 2 and verse 4, that the just shall live by faith. All right, so be not deceived. The Most High is in control of all things. All right. So Lord willing, this quick lesson was edifying unto the elect. And until the next time, shalom.